In this video, I'm going to demonstrate a few tips and techniques that you can do to try to improve your range of motion and strength if you have a meniscus tear of the knee. Now, the meniscus is formed of fibrocartilage. It acts as a shock absorber within the knee, and so it can be torn. There's a lot of different conditions that can cause it to be torn. A lot of times it's as simple as stepping in a hole in the yard, coming off a set of steps or stairs, twisting the knee, overextending, hyperextending, bending, etc. Any of those things can cause a meniscal tear. And so sometimes they require surgery, and then sometimes conservative measures such as therapy or a strength and conditioning program is all that you need to resolve your issues and restore your range of motion and function. Now, of course, before performing any of these exercises or techniques that I show in my videos, make sure you talk to your doctor and that it's okay to do, because my videos are for entertainment purposes only. So the first exercise we're going to do is going to be knee flexion using a rolled up towel or a rolled up blanket. I'm going to put it behind my knee. I'm going to kind of bend back and pull my knee back into me like this, right? Trying to bend my knee into a flexed position. Using that towel or blanket that's rolled up, it's going to give a little bit of joint distraction to the knee. So number one, it's a little more tolerable with a range of motion in most cases. And number two, you're going to get a little more range of motion with bending the knee when you do that movement. And I'd repeat that for 1 to 2 sets, 10 to 15 repetitions a couple times a day. My next exercise is going to be knee extensions using a cuff weight. So I have a cuff weight here on my lower leg, and I'm just going to work on kicking that out, really tightening up my thigh and pulling my toes and foot back to me. I like to activate the tib anterior of the ankle dorsiflexors when we do that. I just personally feel like I get a better quad contraction when I do. Tightening this up, pulling my foot back. I hold it at the top for 1 to 2 seconds, maybe even 3 seconds. And I would do that for a couple of sets, 10 to 12 repetitions, a couple times a day. The next exercise is going to be knee curls in a standing position. So I'm just going to kind of hold onto the table here for stability. I have that same cuff weight around my ankle, and I'm just going to kind of bend my knee and kick back like that. I'm just going to feel that in my hamstring when I come back. And I repeat that for a couple of sets of 10 to 12 repetitions. Now, a point I should make with this, a lot of people turn that into a hip flexion exercise more so than a true knee flexion. So we want to kind of keep the knee back and the thigh back. Don't let it come forward. Just kind of keep it back and go into knee flexion in a more isolated fashion. The last exercise I'm going to do is going to be a quad set, basically in standing, or knee extension in standing right there, that last little bit. So I have this band attached to the mat. I've got it over here just above my knee. And so what I'm going to do is go to I feel tension, and I'm going to push back. So I'm straightening out my knee. So you see me bend my knee, and I'm really working on straightening it out, flattening out my knee, pushing back. And I like to hold that 2 to 3 seconds with each repetition. And I would perform 2 sets for 10 to 12 repetitions a couple times a day. Thanks so much for watching this video. I hope that it helps with your pain and loss of range of motion and strength that you've had with your meniscus tear. Thanks so much.